So here's the real question. How do dentists like you, who aren't willing to let insurance dictate how you will run your practice, who want to create incredibly profitable practices without sacrificing your time or sanity, how do you create the strategies to ensure your practice not only survives, but thrives in the 21st century? That's the blaring question, and Dr. Steve Schlintz is here to provide the answers. Welcome to Dental Practice Freedom Radio.
What is up, everybody? This is Dr. Steve Schlintz. I want to welcome you back to another episode of Dental Practice Freedom Radio. And on this episode, what I want to do is really talk a little bit about this misnomer of communication and sales. And, the ideal is that you wouldn't have to rely on communication for a successful sale. Now, when you hear that, you're going to go, but everything's based on communication. And that's true. But I've seen there's a lot of emphasis out there right now that, in order to be successful in sales, you have to have the right communication style, you have to say the right things, you have to basically use certain words to elicit things, and almost like a form of manipulation. And one of my the mentors that I studied from, just loosely, is Grant Cardone. He talked about that. He said, a lot of sales training relies on neuro-linguistic programming. And he said it's BS because you're manipulating people to do something that might not be in their best interest versus being authentic and real. And that really spoke to me because I do see that quite a bit, that, we're trying to get a patient to do X, Y, and Z, and we know certain words or certain ways to influence them. And I don't know how about you, but is that ethical? I don't know. I guess if you are really sold on what you're doing, then yes, if you know what's in their best interest. But here's the deal, like the patient knows what's in the patient's best interest, right? Or their perceived best interest. And I have always been a firm believer that if I can help the patient get what they want, it may not necessarily be something that I would do in my own mouth, but as long as I can explain the benefits and risks and cons of all this stuff, they get to choose. It's not my role to try to influence them one way or the other. My role is to tell them the truth and let them make a decision, but give them the best possible information so they can make the best possible informed decision, right? Now, as a dentist, when you hear that, believe me, I don't believe that you should spend 2 hours explaining every possible treatment plan to every patient and explain every pro and con and risk and benefit for hours on end, because I can guarantee you one thing will happen if you do that. Nothing. Your patients will never do anything if that is what you try to do. So for me, what I recommend is to try to get away from communication just as a skill by and large. And I know it sounds crazy, right? Because I'm a big believer in communication style. But what I mean by that is the structure of the sales process itself. And so one of the things that I was working on as I was building out Dental Sales Secrets is, what does a successful sales cycle look like if you didn't communicate at all, right? And I'm very heavily influenced by two books that were recommended by one of my mentors, Dr. Michael Schuster, when I first started my management training. And I use these books very, very loosely in the dental office almost every day now. And I keep thinking about some of the things that was said. Peter Senge at MIT said, structure determines behavior, determines results. And I fundamentally believe in my practice, the results that I get from my new patient experience and people moving forward with complete care has everything to do with my structure. It has everything to do with the structure of the new patient experience. It has something to do with communication style, but it's totally overplayed. It's totally overplayed in the dental space. Communication and how do we pass the baton and blah, 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 blah. That's important. I'm not saying it's not, but it's not the be-all, end-all. The reality is the structure that you put your patients in determines where they go more than anything else, right? So if you have a successful structure, you actually don't need to communicate as well. I mean, seriously, look at me when I talk sometimes, right? I make no sense. I'm just rambling on. But the structure of what I'm trying to convey, especially when I'm in my practice, is so it's so regimented that I know where I'm going, why I'm going there, and how I'm going to get my patients on board, that the communication just kind of naturally takes care of itself. So the structure of your process is more important than your communication skills. I firmly believe that, right? Now, once you get the structure in place, then you can really fine-tune it by what you say, how you say it, when you say it, where you inflect, are you hitting their pain points the right way? I mean, all this stuff, right? All the stuff that we've learned. But I think that the structure is often missed in this whole thing, where I have a very definitive structure in my practice. And I do not delineate from that, because when I do, my case acceptance plummets. It happens every time, right? There is a proven structure to get the result that I want. So remember that. Structure determines behavior, determines results. Now, another way you can think of it, I've heard it in a different way, structure influences behavior, behavior determines results. So the structure you put your patients in influences their behavior. It's one of the first reasons that I put my patients in a consult room before a treatment room. Treatment rooms have a certain type of connotation. A consult room is something that they've probably never been in before when they see a new dentist. This is going to influence behavior in a different way, right? They're not going to have the preset things that they're so used to having when all of a sudden they're in a different type of environment. Sorry, my phone just rang. So the structure is very, very important. And I want you guys as dentists to understand this, because I think we get so concerned about our verbal skills, and we get so wrapped up in that we actually do more harm than good. We overthink things. Just be real and authentic, right? Don't try to sugarcoat things. Don't try to manipulate the situation. Just be real with your patients. But when you have a structure that's built on, in my practice, my structure is built on creating wellness as a partner versus simply treating disease all day long, it influences a different type of behavior. I get the right type of patients in, I influence their behavior because now they're going to be more wellness centered, and that's going to determine a specific result in my practice, which is I want my patients to never have to, I've always said this to my patients, listen, my goal is to get you so healthy you never have to see me again. And I know that sounds crazy because you think if you come in the dentist every 6 months, I keep my job. The reality is I would have a much better time taking care of you at a level that myself and you think is absolutely unbelievable. Be able to put long-term dentistry in there that lasts your lifetime. Never have to worry about getting more disease. And you can refer as many patients as you want to me because I know everybody is looking for that same thing. That's what I'm trying to shoot for. And that's how I built my practice. And, I think that we need to get out of this communication thing that is really, really kind of stifling the industry because it gets so hard. I mean, we're not orators. I mean, listen to myself. So, you could spend years and years and years trying to learn what to say, or you could spend a little bit of time putting the right structure in place and it will solve almost all of your issues. So hopefully you got some value out of this. And guys, thanks so much for listening. I'm getting so much great feedback and so many great reviews and ratings. And I encourage you, please, if you enjoy this podcast, go to iTunes, leave me a review, leave me a rating. Check out dentalsalessecrets.com. It's a free training for you. It talks about what I do in my practice to differentiate myself and how you can do the same thing to increase your case acceptance. So I've heard a lot of good things about that. And so check that out. And thank you so much for listening and have a great day. Bye.
Thank you so much for listening to this episode on Dental Practice Freedom Radio with Dr. Steve Schlitz. We'll see you on the next episode.